Hello, everybody. Welcome back to Project Disclosure. Ladies and gentlemen, it is January 22nd, 2020. And today's headlines is concerning this new coronavirus that has emerged from China. I have some information on this virus that I feel each and every one of you should heed, knowing that the first case of this virus has emerged in the state of Washington. But we're going to go over some basic information pertaining to the coronavirus. Now, this coronavirus, they're stating that it is the cousin of the wicked SARS virus. And so far, it has infected hundreds of people since the beginning of its outbreak in Wuhan, China in December. Now, what we know so far is that it does cause a very, very severe pneumonia, and it does not, I repeat, it does not respond to any antibiotic treatments. And that's kind of not surprising. When the SARS virus first came out, it had a mortality rate of about 10%. Meaning 10% of the people that contracted the coronavirus or SARS passed away. There is a virologist by the name of Dr. Poon. He has discovered this recent virus, and it is part of the family of coronaviruses. Now, the World Health Organization is offering some guidance to countries on how they can prepare for it and how they can monitor the people who are sick. Because, again, this virus does not respond to conventional treatments. So you say to yourself, well, what is this coronavirus? And coronaviruses are part of a large group of viruses that are common among animals. In rare cases, they are what scientists call zoonotics, meaning that they can be transmitted from animals to humans, and that is according to the C.D.C. Now, the symptoms of this coronavirus. The viruses can make people very sick, naturally, usually with a mild to moderate upper respiratory tract illness, similar to the common cold. Coronavirus symptoms include a runny nose, cough, sore throat, possibly a headache, and maybe fever, which can last for days and possibly even for weeks. For those with a weakened immune system, the elderly and the very young, there's a chance that the virus can cause a lower and much more serious respiratory tract illness like pneumonia or bronchitis. Now, there is another form of this coronavirus. It is referred to as the Middle East Respiratory Syndrome, also known as the MERS virus. And that was first reported back in the Middle East in 2012. The symptoms are quite similar. There is also another member of this coronavirus family, severe acute respiratory syndrome, also known as SARS. Now, folks, how it spreads. Viruses can spread from human contact with animals. Scientists think that MERS started in camels, according to the WHO. With SARS, scientists suspected cats were to blame. When it comes to human transmission of the viruses, often it happens when people come in contact with infected persons' secretions. Yes, I know that sounds gross. Now, depending on how virulent the virus is, a cough, sneeze, or handshake could cause exposure. The virus can also be transmitted by touching something that an infected person has touched, and then touching your mouth, your nose, and your eyes can cause the infection instantaneously. Now, the treatment for this coronavirus. As I stated earlier, there is no specific treatment. Most of the time, the symptoms will go away on their own. But from what I've been researching and what I've been reading, the symptoms will go away on their own. However, depending on your individual age and your individual health, medications, antibiotics, they're not going to help. So for instance, for people who have asthma or COPD or any other type of breathing affliction, you are going to be in a greater risk factor for having very serious complications. So on the first signs of fever, sore throat, the achiness. Look, folks, we all know what the flu feels like. My recommendation is to get to your doctor as soon as possible. If you don't have a primary doctor, go to the emergency room. Now, how you can prevent this. And this is where I actually had a few conversations with a few friends of mine that actually work in the public. One of my friends is a physical fitness instructor at a Planet Fitness center. And she told me that last year was just absolutely horrible. People were coming to the gym, you're sweating, you're coughing, your bodily secretions are all over the place. And as much as they try to keep all of the equipment clean, well, it's a germ, folks. It's very small. So your chances of contracting the virus, well, they're at an increase. Now, she said they are already trying to prevent this at the Planet Fitness gym where she works. Last year, she got the flu virus, not this coronavirus, but a flu virus, and it hung on for 4 weeks, causing her to actually miss work for the first 10 days. So, keeping your hands clean, covering your mouth when you sneeze or cough, avoiding contact with large groups of people. But in that circumstance, ladies and gentlemen, you have to go out, you have to go to the store. You don't realize everything you touch. Like, for instance, at a gas station, you go and you pump your gas. Well, you don't know who touched the gas pump nozzle just before you did. So if somebody was sick and they were coughing into their hands, did not wash them, did not disinfect them, and then pumped their gas. And then here you come strolling along, filling up your tank, and you touch that gas nozzle. And then you get in your car and you touch your steering wheel and your gear shift and your turn signal. And then maybe you take a stick of gum and put it in your mouth, or rub your eyes, or rub your nose. So therefore, you see how the infection can spread very, very rapidly. Now, I spoke with another friend of mine, and he works at a bank. Same situation that my friend at the gym had. Touching money. Well, look, folks, we all have to touch money. We all love to touch money. But he had very, very serious issues at the bank where he works. The flu virus went rampant through the bank. Everybody got it, and it lasted in their bank business for 3 straight months. One person after the next. And if you know that you are sick, you should call off of work and take care of yourself. Get medical attention as soon as possible. Now, all too often, people cannot afford to just take off of work. And let's say you work in a shopping center, a Walmart, a department store, where you are going to be around hundreds, if not thousands of people per day. So you see, if you go to work in those first 7 days where you are really, really sick, and naturally you're coughing, you're sneezing, you're touching everything in the store that others are about to touch. So you see, you can spread this virus to literally hundreds, if not thousands, of people. So I hope everybody sees the broad picture here of how this virus can spread very, very rapidly. Now, I do know that in airports and with a lot of airlines here in the United States, they are already checking people for these symptoms, and they're literally not allowing them on the plane. And this is being conducted at several major hubs here in the United States. Now, the coronavirus and pregnancy, that is a big issue. There have been several studies related to MERS and SARS back in 2014. And women that were infected with this coronavirus, MERS or SARS, had a very, very high percentage of stillbirth. So again, if you are pregnant, you need to be vigilant. You need to pay very close attention to your health. We all know that. So, taking these precautions, knowing that you have to go out, you have to do things, just be on alert. Now, me, I'm a germophobic. If I go into a store and I'm walking down an aisle, and at the middle of the aisle, I see somebody coughing and sneezing and hacking all over the place, no matter what I want in that aisle, I turn around and I go all the way to the other end of the store. I don't want to be around it. I haven't had the flu in 21 years. Now, I've been taking an herb for the last 22 years, I believe. Let's see. Yeah, it's about 22 years. Yes, the name of this herb is called astragalus. And when I started taking it, it really wasn't available in the United States. I was ordering it over the internet and from Europe. I used to fly for a living, and I was constantly getting sick from these airplanes. And I looked up, ways I could boost my immune system. And this Chinese herb, astragalus, was the ticket. So if any of you want to, go to your local vitamin store, GNC, and ask about astragalus, or do some research on your own before starting to take this supplement. Now, once you have astragalus in your system and a buildup in your system, coming in contact with germs and viruses, if you actually end up getting sick, it really, really does lessen the effects, meaning you may not be sick for 10, 14, 21, 28 days. Now, if I get a little sore throat, it lasts maybe 1 day, if that. So I've been taking the astragalus. I take 2 capsules, 500 milligrams every single day. So before you start taking anything like this supplement, do your research. Make sure that it would not interact with any other kind of medications that you would be taking. But boosting your immune system in today's world with these coronaviruses and these flus, well, we all know that millions of people have died over the centuries, over the decades, from things like this. So boosting your immune system, keeping yourself in good health, is always the right thing to do. Now, here was something that was very interesting. This coronavirus can actually be transferred from you to your pets, such as cats and dogs and other animals, and vice versa. So maybe you have an outdoor cat. Maybe your cat came in contact with the virus, and the cat comes into the house. And naturally, you're petting and you're hugging and you're cuddling with your cat or your dog. Bingo. So these are the ways that you can get sick. Now, in the infected animals, one of the main symptoms is diarrhea. The animal will have very severe diarrhea and dehydration. So their symptoms aren't exactly like ours. But on the first sight of your animal being sick, do not take any chances. Take your animal to the vet, and hopefully they could save the animal, because the mortality rate with cats and dogs and other animals, contracting coronavirus is not good. So again, pay attention. Pay attention. And again, let me repeat myself. Keep your hands clean. Disinfect your hands. Avoid direct contact with people that you know are sick. Wash your hands. Disinfect your hands. And if you kind of forget and you're out and you're touching things in a shopping cart, do not touch your face. Do not touch food and put it into your mouth knowing that your hands were not clean. Do not rub your eyes. Do not rub your nose. So maybe pick up a little hand sanitizer. Ladies, you are pretty good at keeping it in your purse. Guys, But listen, you could get a little bottle, you could stick it in your pocket, and if you notice somebody at work that is really sick and they seem to not care about infecting others, maybe you might want to pull that person to the side and say, hey, listen, Bob, you seem to be pretty sick. You're going to infect all of us. Why don't you take a couple of days off? Maybe go to the doctor. Now, my friend that worked at the bank that I mentioned earlier, they have a policy now in effect that if you are sick and you do have the flu, you are now not permitted to come to work for 3 to 5 days. Therefore, trying to stop the spread of these viruses. Ladies and gentlemen, that's the best information that I could give you at this time. And I'm going to leave a link in the description box under this video. And it is related to an article that I wrote this morning. And it also has the announcement from the C.D.C. and what is occurring out in the state of Washington with the first person to be infected by this coronavirus here in the United States. So you may want to watch the press conference video and listen to what they have to say. I hope the information that you received here today will help you, and I definitely hope that you stay healthy and you do not contract this flu virus. And That is your exposure